Consultations of GPs with patients with suspected urinary tract infections are straightforward, and GPs generally prescribe antibiotics empirically. UTIs are generally self-limiting, so why is it so acceptable to prescribe antibiotics given the rise in resistance worldwide? To understand attitudes regarding alternative delayed or symptomatic treatment for UTI, we conducted 15 interviews with patients and 9 with GPs. In general, if the GP suspects a UTI, antibiotics are prescribed, irrespective of symptoms, pain or dipstick results. Patients are similarly so used to receiving an antibiotic for a UTI that they don't even consider possible negative side effects. So how do they feel about delaying prescribing? Delayed prescribing for respiratory infections is very accepted, but for UTIs, GPs are not comfortable with delaying since they feel an antibiotic is needed anyway. Patients are unfamiliar with delayed prescribing for UTI and generally express concern. It was clear from the interviews that the leap from antibiotics to no medication for UTI is too big and may be easier by prescribing a painkiller as an alternative approach. The majority of patients did not have any experience with symptomatic UTI treatment. However, patients said that they would follow their GP's advice. The belief that an antibiotic is needed is, however, deeply rooted. Patients also worry about the financial implication of symptomatic treatment. GPs fear for complications when treating UTI symptomatically. Others point out issues about patient satisfaction and increased attendance. Interestingly, even though there is a reluctance to take antibiotics, there is no mention by patients or GPs of antibiotic resistance or its implications on the treatment of infections. So, what did we learn? As long as the main message about antibiotics and resistance is not clear, there may be a willingness to find alternatives to antibiotic treatment, but implementation needs conviction, which is currently just not there.